Hello everybody, my name is Jessica Dillon. I am a first year occupational therapy student here at Saginaw Valley State University, and today I am going to be discussing Guillain-Barré syndrome. So before we get started, I just want to quickly share an overview of what this presentation will entail. And to start, we are just going to briefly talk about what Guillain-Barré syndrome is, and then we will move into general information such as etiology, pathophysiology, clinical course, symptomatology, as well as prognosis. And then we will move into general treatment for this rare disease and the role occupational therapy plays within it. And then finally, I will showcase two different community support agencies. So Guillain-Barré syndrome is also known as GBS, and it is a rare neurological disorder that creates an autoimmune response that attacks the peripheral nervous system, or the PNS. And just for a reminder, the peripheral nervous system are all of the nerves outside of the brain and the spinal cord. And nearly 100,000 people worldwide develop GBS annually, which really isn't that many people. And it is also the most common cause of acute flaccid paralysis in the United States. And flaccid paralysis is known as loose and floppy limbs. And I kind of chose this picture to the left because it really demonstrates what Guillain-Barré does to a healthy nerve. So on the left, you have your normal myelin sheath covering the nerve fiber, and then on the right, you can see that GBS damages that myelin sheath. So as I stated earlier, Guillain-Barré syndrome is a rare neurological disease, which means that we don't know everything about it, and there's always room for more research and a better understanding. So right now, the exact cause of GBS is unknown, but most GBS cases, around 70% of them, have been known to start 1 to 6 weeks following a respiratory or gastrointestinal viral infection. And this just suggests that it is a post-infectious, immune-mediated disease, also meaning that it is triggered by the immune response due to either a bacterial or viral infection. And the Zika virus actually in some countries has increased the rates of GBS, and very rarely surgery has been thought to trigger GBS as well. And even with the COVID-19 pandemic today, it's caused increased numbers of GBS. And I found that controversially, certain vaccinations could potentially trigger GBS. So for example, the swine flu vaccination in 1976 increased rates, and the simple rabies vaccine in 1980 produced GBS in 7% of its vaccine recipients. GBS also is not contagious or inherited. It's important to note that Guillain-Barré syndrome has numerous subtypes or different variants of it, and GBS is really an umbrella term covering a spectrum rather than just one single state that affects the PNS. And these subtypes may involve different nerve fibers, so it could only affect sensory, motor, or autonomic nerves, and the predominant nature of the peripheral nerve or nerve root injury. So the injury or damage could be strictly the axon or the myelin sheath. So some common subtypes include acute inflammatory demyelinating polyradiculopathy, and this is the most common form in Western countries, so what we see here, and this accounts for 90 to 95% of cases. And with this specific subtype, it predominantly affects the myelin sheath. Another popular one is acute motor axonal neuropathy, and this is less common here in Western countries, but it is very predominant in northern China, accounting for about 65% of cases, and this mainly affects the axons of the nerves. And then there's also acute motor and sensory axonal neuropathy, and this is often pretty severe due to motor and sensory involvement rather than just one or the other, and it is predominantly affected by the axons of the motor and sensory nerves. And it's important to note that although there are different subtypes, many of them have similar signs, symptoms, and disease courses. So GBS is a neuronal inflammation triggered by infection or other immune stimulation, which creates an autoimmune response targeting peripheral nerves and their spinal roots. 70% of patients with Guillain-Barré syndrome report antecedent or previous infection prior to the onset of symptoms through GBS. And as I stated previously, GBS is rare and not completely understood. So what we do know is that evidence suggests that molecular mimicry plays a role in GBS, especially the axonal affected subtypes. So when infection enters the body, the immune system is stimulated to remove the harmful organisms. In molecular mimicry, the bacterial or viral microorganisms resemble those of the nerve cells. So when the T cells and antibodies of the immune system complete its attack on that foreign microorganism, it continues to attack the healthy peripheral nerve cells due to the resemblance or mimicry of the invasive microorganisms. We have also kind of found that gangliosides, which are just kind of one type of molecule found within many of the associated bacterial and viral infections with GBS, have similar structure to components found within the peripheral nerves, which lead to its destruction from the immune system and ultimately results in nerve dysfunction. And not all cases, though, produce these ganglioside-like antibodies during testing, which results in the need for more research relating to subtypes and where the immune system continues to attack the PNS when ganglioside molecules are not present. So again, patients with Guillain-Barré syndrome typically acquire some form of respiratory or gastrointestinal infection, which results in the onset of GBS, and the first sign of symptoms, which is usually bilateral weakness, can rapidly present 1 to 2 weeks following initial immune stimulation. So at 2 to 4 weeks from GBS onset, patients experience major symptoms and are at the peak of the illness, even though progression can last up to 6 weeks in rare cases. Following the peak of symptoms, a recovery period where all patients begin to improve follows that can last months or years depending on the severity of the case and what type of subtype or variant they have and if it attacked the myelin or the axons of the nerve. So in this period, the immune system kind of backs off and the peripheral nervous system begins to slowly rebuild itself. And although people are recovering, some may experience permanent disability. And again, this is in severe cases depending on what subtype they acquired. With GBS, symptoms can increase in severity within hours, days, or weeks, even to the point where there is complete paralysis. So when severe, a person is nearly paralyzed and in a life-threatening situation due to respiratory and cardiovascular interference. The first sign of GBS are unexplained sensations such as tingling in the hands or feet or pain in the legs or the back. These early symptoms will typically disappear before the major longer-term symptoms appear. And someone will eventually begin to experience major weakness on both sides of the body, which is the first major symptom, and many will seek medical attention at this point. Major weakness will usually affect the arms, the respiratory muscles, and even the face, which represents more widespread nerve damage. And occasionally symptoms may begin in the upper body and eventually move to the lower body. Continuing with symptomatology, in addition to muscle weakness, common symptoms include difficulty with eye muscles and vision, difficulty swallowing, speaking, or chewing, pricking or pins and needles sensations in the hands and the feet, also known as paresthesias, severe pain, especially at night, coordination problems and unsteadiness, abnormal heart rate or blood pressure, and digestion problems and or bladder control. So following the acute phase of Guillain-Barré syndrome, patients tend to do pretty well and have a pretty positive prognosis. I found a stat that says more than 80% achieve independent ambulation after 6 months. Among those diagnosed with Guillain-Barré syndrome, about 50% return to normal health by 1 year. However, about 1/3 of those diagnosed report continued muscle weakness even after 3 years. So although most prognoses are good, less than 20% of patients are left with considerable disabilities and could even die from this disease. So predictors for worse outcomes include older age, specific C. jejuni infection, which is a infection that is found in a lot of cases of GBS, and need for ventilation also is a predictor for worse outcomes, as well as a subtype targeting nerve axons. So the duration of recovery is dependent on type of nerve damage, again, myelin or axonal, and the location and ability to repair that damage. So residual fatigue, pain, and paresthesias may persist following a full recovery for several years. Once someone is diagnosed with Guillain-Barré syndrome, treatment should begin immediately. A delay in treatment has been linked to increased nerve damage, which results in delayed or incomplete recovery. And as of today, there are 2 treatment options that have been found to be effective. And the first one is plasma exchange, and this is thought to act by removing pathogenic antibodies, humoral mediators, and complement proteins involved in the pathogenesis of GBS. And the second treatment option is intravenous immunoglobulin, and this is immune modulating action. And both have been shown to be equally efficient, especially among acute inflammatory demyelinating polyradiculopathy, which is that most common subtype found within the Western countries. And it is effective if treatment begins within 4 weeks of onset, but there's a stronger effect when started within the initial 2 weeks. And treatment is thought to shorten the course of recovery. Moving on to the role of occupational therapy treatment within the recovery process of Guillain-Barré syndrome. Again, due to the rarity of the disease, studies showcasing the impact of OT intervention on GBS is scarce. Although a full recovery is possible following GBS treatment, activities of daily living and muscular function may be negatively affected even 3 to 6 years following onset. And this just displays the need for rehabilitation services to increase the likelihood of independence in activities of daily living and muscular function. OT intervention can also maintain or prevent further motor and sensory demyelination and regain functionability that was previously lost due to GBS. And this can be used to address performance skills such as strength, range of motion, motor control, sensory re-education, and teaching compensatory strategies. And due to the potential of continued muscle weakness even after 3 years, OT should look to meet functional recovery goals within 1 year of GBS onset. As I was doing my research and looking for community agencies that provided information and resources for GBS patients and families and friends, I had a really hard time because, like I said, it is a rare disease and not many people know about it or are talking about it. But all of my searches came back to this organization called GBS/CIDP Foundation International, and this group works to provide emotional support and assistance to those with GBS. And some of their services include arranging personal visits to individuals in hospitals and rehab centers. They support research into the rare disease pertaining to cause, treatment, and other aspects of the disorder. And they also direct affected individuals with long-term disabilities to resources for vocational, financial, and other forms of assistance. So they really help provide information regarding community events, which they hold regularly, from local chapter events to what they call the Biennial International Symposium. And finally, they also provide opportunities for support groups through Facebook, Twitter, organizational forums, and local chapters. So if you are looking for more information on this group, I did include the link in my slides, so I highly recommend going and just exploring that website yourself. So after doing some digging, I was able to find what is called the National Organization for Rare Disorders. And although they are not strictly related to GBS, GBS is included underneath their umbrella of rare disorders. And they are just a resourceful and knowledgeable space for those with rare disorders, including GBS. And they help to provide a variety of opportunities for patients and families by offering educational information and resources. They help access medications. They also connect with others through different groups and support systems. And they also take action through advocacy efforts, which allows like volunteers, patients, families to get involved with that work as well. And some of their unique features include information on clinical trials and research studies, information to start your own patient organization due to the fact that we are dealing with rare diseases and you may not find exactly what you're looking for. So they offer that opportunity for you. And then they also allow you to learn and participate in what they call is Rare Disease Day, which is February 28th. And they provide information about events, how you can get involved, what they call showing your stripes on Rare Disease Day. And I thought this was cool because the zebra is the international symbol for rare disorders. And then even you can shop to support this. So again, I included the link. I would highly recommend checking this website out because they give a bunch of information on so many different rare disorders, and you can find some really neat information here. So the link is provided in the slide, and have fun exploring. So here are some of the references that I utilized throughout my presentation. And my references continue onto this slide. And with that, I am concluding my presentation on Guillain-Barré syndrome. So hopefully you found something interesting and you learned a little bit, and you're able to potentially apply some of this information in the field of OT one day. So have a great night, and thank you for listening.